Hi guys, it's me, Dr. Yumna Asad, and today I'm going to discuss with you how the basic tips and tricks on how to pass the AMC clinical exam. So let's begin. First of all, here's a list of textbooks that you all should have in order to pass this exam. Um, so these are a must. So the most important things regarding this is always make sure that you have got the latest edition of these books. These are some of these are the AMC. The most important ones are the AMC Clinical Handbook and the John Murtagh. The third one, the John Murtagh's Patient Education. It's optional. It has got good information if you want to discuss with the patient something in layman terms. So if you want to have a read, you can go for it. But as I said, it's optional. But the first two, they are must. And also for clinical examinations, the Tell Your Corner book, it's really, really good. It's a bit lengthy, but what you can do is you can make short notes out of it. So it's basically a standard, and the ASC clinical examiners basically they follow this book. So it's good to have a read it, one at least one read. Okay, so here is a list of other useful resources that you should consider while preparing for your exam. Because keep that in mind that AMC clinical exam, they always follow the Australian guidelines. So here's a list of, because there are many other resources, including maybe Medscape or something else, but try to follow those that are Australian guidelines because the things keep on changing, especially the management. So it's good to give a reference from Australia, somewhere from Australia. The last two, the Geeky Medics and Oskistop, they are specifically for the physical examinations. They are really good to give you an idea how to cover your clinical examinations in a concise manner. Okay, so now here's the study plan. First of all, once you make sure you make a plan to appear in the AMC clinical exam, the first thing you need to do is to find a study partner. So study partners should be compatible to you with your circumstances. For example, if you are working full time or if you are not working and you can give more time to the studies. So it all depends. It varies from person to person. Some people who are working, they can pass this exam by doing just 1 month preparation, whereas for some, it may take up to 6 months or even a year or more than a year. So it depends on your circumstances. So try to find some who is comfortable to be with you and in a similar time zone, and try to do a video call or maybe an audio call, or if face to face, then it will be the best. So as I told you, the time for preparation, it varies. So strategic study is try to figure out what works best for you. If you want to study it system wise, subject wise, like medicine and surgery, gynae, of speech, and so on, you can do like that. Or if you can you can simply do like what I did. You can start with the AMC clinical handbook, which is followed by some together with clinical examinations, and it is followed by doing recalls and then gathering all together. The next important thing is to make some simple clusters. It's very, very important. In my next few videos, I will definitely be telling you this important clusters according to each subject. Like there are some important clusters in pediatrics, some important clusters in medicine and surgery, gynae, psychiatry. So it will give you an idea how to prepare many different recalls and scenarios more concisely. So it's good. It's a good approach. Most important thing is to make your own notes. It should not be by own notes. I do not mean that you should prepare the lengthy notes and write each and everything, but you should make at least some bullet points. Or if you have taken some important points from RSCGP for say, or from RCH or from other different sites, just write it down at some point that you have, or you can add it to your handbook as well. That I have read it from RCH or RSCGP, so that in future when you are revising, you will it will be easier for you to recollect. Role plays is very, very important. So start doing role plays from the very beginning. Once you find a sturdy partner, start doing the handbook. Start with the handbook. Just give it a read. Don't worry, definitely you won't be remembering anything at all after one read. So just give it a read. It will give you an idea how the system works. And after the first read, start doing recalls and do it in a role play manner. Set a timer for around 7 minutes, because as you know that inside the room you will be given 8 minutes. So it's good to practice within 7 minutes time, because like 20 or 30 seconds are lost in introduction and patient greeting the patients. So you should keep in mind that you'll have around 7 minutes inside the room. So it's very, very important to do role plays with a timer. with your study partners. Practice physical examinations daily and from the beginning. One of the biggest mistakes that most candidates do is they leave the physical examinations towards the end of their preparation. So please, please, please don't do that, because physical exam nowadays AMC is giving around 4 physical examinations. So out of your total 16 scenarios, as you know, four will be rest stations. The 16 will There will be 16 stations. Out of those 16, there will be two pilot ones. So out of 16 stations, there will be at least around 4 physical examinations. So if you pass those 4 physical examinations, you have a good chance to pass the exam. So please make sure that you start practicing physical examinations, because believe me, it's going to take a lot of time to finish your physical examinations within the given time. Because if you don't do that, you will be shaky in the exam and it will not give a good impression. And most importantly, believe in yourself. You all are doctors, you are qualified, so you can pass this exam easily. All you need is just confidence and some knowledge as well. So here are the basic tips and tricks, most of which I've already discussed with you. The most important, starting with the AMC Clinical Handbook, as I just told you, that give it a read, just one read. You won't be remembering anything at all after the first read, but it's just to give you an idea how the AMC exam basically works, what basic scenarios there are, and how to approach the cases, and how much knowledge they expect from you. So it's just to give you an idea. So you can just give it a read. If you want, you can do a role play with your uh, study partners. The next thing is to do the recall, collect the recalls. Once you have collected the recalls, arrange it in whatever manner you like, either month-wise or subject-wise or cluster-wise, whatever manner you like, and try to practice recalls. By recalls, I mean only the topics. Do not rely on the recalls entirely, because they are written once a person has given the exam, so there are recall errors and biases. So you just can't uh, rely on the recalls entirely. It's just to give you an idea what cases and what topics are coming in. So you must be aware that these are the important topics. It gives you an indication that if, for example, there are a few topics that are coming again and again, like migraine, like there are different types of coughs in pediatrics, and uh, the heavy menstrual bleeding in gynaeops or placenta previa, and so on. The list goes on, but there are some topics that keep on repeating. So, and you can say that AMC hot favorite topics. So, just to get an idea, collect the recalls and do role plays. Again, as I told you earlier, set a timer for 7 minutes. So make sure whether it's a clinical scenario or whether it's a physical examination, you are able to complete it within 7 minutes time, because 1 minute in the exam will be lost that you have with your panic hand while meeting and greeting the patient. So you, technically speaking, you will only get 7 minutes. All right. The next thing is, as I told you, read the scenarios carefully. Because in the scenario, it's many important informations are given. Like first of all, most important thing is what setting you are in. Is it a GP setting? Is it are you in a hospital, HMO in a hospital? Are you an intern? Are you in a city or like in a metropolitan area? Are you in a rural setting? So first of all, try to gather that information. The next important thing is to look at the STEM, whatever information is giving, and what are your tasks are. But don't be worried if it's a long scenario and you are confused that you won't be remembering, because the same STEM will be there inside the room. So if you miss a task, you can have a look at, and please always make a habit of confirming that you have covered all the tasks once you are inside the room. You have finished your case, and if there's time remaining, have a look at the task again, just to make sure that you have not missed anything. Okay, so if there are just two tasks, like take history and give the differentials and diagnosis, so spend good time on history. But if there are 3 or 4 tasks, including history, investigations, diagnosis, and management, so there are 4 different tasks. So try not to spend more than 1 or 1.5 minutes on every task. So you have to do all that very quickly. So you just make that in mind, that how to approach a case and how much time you should be spending on every task. Uh, the next thing is it's a tip that worked for me, and I would like you to do as well. Once you're doing recalls, role plays with your study partner, try to make a video of yourself and watch it later. That how was your body language during the role play? Were you looking here and there? Were you very confused? Were you going too fast or were you too slow? And after that, have a look at it, and it will help you improve your performance. Okay, so be like a real doctor. Don't become shaky in front of the patient, because I know all of you, you know everything. You've got the knowledge. So just be confident, and the patient, where there will be role play and there will be you. The examiner usually sits behind you. You won't be facing the examiner, so don't get panicked by seeing the examiner once you enter the room. So greet the examiner and just be confident and start taking the history and so on. And the most important thing in clinical scenario is, if they ask you to give differentials, try to give the relevant differentials. For example, if there is a case of headache, do not give all the 8 to 10 differentials of headache in one go, starting from migraine and ending to the tumor. It's going to give you a very, very bad marking. They will it's just like negative marking. You'll mark down because of your performance, because it gives them an idea that you don't know what the case exactly is. If a person has come to you, for example, with a complaint of a headache for many months, that is typically on one side of the head, is triggered by some bright flashing lights and loud sounds and noises, and associated with nausea, vomiting. There's also a family history of migraine, and the patient is giving you so many important tips and clues to indicate towards migraine. So definitely your diagnosis will be migraine. In But in differentials, try to give the other relevant ones, like it can be tension headache, it can be cluster headache, or if there's a history of fever, some past fever of upper respiratory tract infection. It can be sinusitis or upper respiratory tract infection. But please do not give diagnosis if a patient is having headache for months. Can it be meningitis? No, never. Can it be a tumor? Very less likely. Can it be a subarachnoid hemorrhage and other blah blah blah? No, very, very less likely. So try to give the relevant differentials. On the other hand, if the patient has come to you with a headache, very acute headache, and early morning vomiting, and a raised intracranial pressure, and all that, so that's definitely going to give you some idea about if there's a space occupying lesion. In that case, you can give definitely, yeah, break a bad news regarding it can be a space occupying lesion or a tumor. But act accordingly. According to your history, give the differentials. 2 or 3 relevant differentials would be enough, rather than giving 8 or 10 irrelevant differentials. So these are all the basic tips and tricks I want to discuss with you. In my next videos, I'll be covering different subjects in cluster-wise form. If you have any queries, do let me know and I'll try to answer them as soon as possible. Thank you and have a good one.